In this video, I'm going to talk a little bit about exercise for chronic fatigue syndrome and long COVID. Research suggests that graded exercise therapy can be very helpful in patients who suffer from chronic fatigue syndrome and long COVID. However, patients don't always experience a significant improvement in their symptoms. The fact remains that some people respond really well to exercise and others don't respond at all. So exercise shouldn't be dismissed, and we should be thinking about why certain patients don't respond to exercise as well as others. Currently, the treatments that are available for patients who are suffering from chronic fatigue syndrome and by extension long COVID would be things like adaptive pacing therapy, cognitive behavioural therapy, graded exercise therapy and specialist medical intervention. So for specialist medical intervention, this essentially refers to the interaction between you and your healthcare professional in terms of symptom evaluation and explanation for the symptoms you might be experiencing, some generic advice on what you should or shouldn't do, such as avoiding excessive activity, but also avoiding excessive rest, and then looking at various symptoms that might warrant a medical treatment, such as chronic pain. Cognitive behavioural therapy I'm not really going to talk about because I'm not a psychologist, but it does seem to have a lot of positive benefits in patients who have chronic fatigue syndrome. Adaptive pacing therapy is based on the idea that the symptoms of chronic fatigue syndrome are not reversible and that really you need to pace your activity based on the levels of energy that you have. So the advice would be to try to become aware of activities that tend to exacerbate your symptoms and to learn how to avoid those, and pace yourself based on the energy levels that you have every day. So it's more about living with the condition than necessarily improving your symptoms. Increased activity is advisable with the pacing program, but if it worsens your symptoms, then that activity should be limited. So pacing is a good idea, but it really depends on the level of your symptoms. So if you are someone who has chronic fatigue syndrome but has managed to return to work and you feel that you're kind of almost back to normal, then pacing is a good idea because it sounds like the symptoms aren't actually having a hugely negative impact upon your quality of life. But the disadvantage of pacing is really for people who are very symptomatic and maybe out of work, because learning to live with that level of activity may not at all be conducive to what that person's life was or what they need to be doing. So pacing is important, but again, the disadvantage being that you may end up more living with your symptoms than trying to improve your symptoms. Graded exercise treatment or therapy is based on the idea that deconditioning might underlie a lot of the symptoms of chronic fatigue syndrome, and the idea is that in chronic fatigue syndrome there is a physiological condition that is reversible through gradually increasing the amount of activity that you're doing. And again, this is the one where some people respond really well and others don't. When you're going to embark on a graded exercise program, a number of factors really need to be taken into account. Your baseline level of activity prior to experiencing symptoms of chronic fatigue syndrome or long COVID are really important. Your baseline beliefs about whether or not exercise will help and your baseline medical history are all important components of the graded exercise therapy. It's also really important that an individualized approach is used because this is not a one-size-fits-all, and not every type of exercise will be suitable for every person. It's a good idea to start with really, really small amounts of exercise. So when I advise patients to exercise with symptoms of long COVID and chronic fatigue syndrome, my advice is to start with as little as 2 or 3 minutes a day. And that might sound like it's so little that it really couldn't make any difference, but it really is the place to start, and what you are trying to do is find something that you can build upon over time. So you're really just trying to reintroduce or introduce for the first time this concept of exercise to your system and gradually build on it over time. Pacing can actually form a component of the graded exercise program as well, because you will need an amount of pacing to allow this exercise program to work. So if you have, for example, an extremely busy job, or you have a lot of out of work commitments, if you have young kids and you spend a lot of time going to various activities with them, then you do need to be mindful of how much energy you're going to have to do an amount of exercise. So this is where looking at how the exercise can fit into your routine becomes really important and is an extremely important component of the success of an exercise program. So if you know, for example, on a Monday and Wednesday, those days are just going to be extremely busy and you're going to be in work all day and then doing activities in the evening, you mightn't get home till 8 p.m. or so, then it's not a good idea on that day to do any exercise. So you might leave your exercise for days that are less busy, and hopefully there will be some days during your week that are less busy. So that's the first thing, trying to do really small amounts of exercise and trying to fit it into your routine. Another really important component at the start of an exercise program is the focus on the intensity. My advice to patients is not to focus so much on the intensity in the initial stages of the exercise program. What you're trying to do at the start is just get used to doing some kind of exercise, start trying to make it part of your routine. You'll be going at a relaxed pace, you won't be getting out of breath, you're not trying to reach any particular heart rate target. And then over a number of weeks, you'll start hopefully getting to slightly longer amounts of exercise. And when you're up at around 15 minutes at a relaxed pace on perhaps a rowing machine or an exercise bike, it's at that point that you can start thinking about increasing the intensity of the exercise. In addition to increasing the intensity, you'll be looking at increasing the frequency of the exercise. And like I said earlier in the video, while you'll be starting at 2 or 3 minutes during an exercise session, you'll be gradually increasing that up. But you don't increase from the 2 or 3 minutes to 4 minutes to 5 minutes to 6 minutes, etc. until the number of minutes you're on doesn't feel like anything. So what you're looking to be in a state that if you do your 3 minutes of exercise, that you feel pretty much back to normal very soon after the exercise. And if that happens, that's when you start increasing the number of minutes. So you're not put like on a fixed program. It's not like week 1 you do this, week 2, week 3. It has to be dictated by how you are responding to the exercise program. When it comes to prescribing exercise in conditions like long COVID and chronic fatigue syndrome, there is some controversy attached to it because there are a lot of patient groups who feel that exercise makes their symptoms worse. And there are groups of patients where exercise just doesn't work for them. They can get extreme symptoms of post-exertion malaise, it can set them back. And this has led to a very negative experience of the exercise. So what has been demonstrated is that when it comes to an exercise program, what's really, really important in terms of the overall success of the program is that the person is supported through their exercise program by their healthcare professionals. So having frequent face-to-face consultations is a really positive thing in any exercise program because it allows the patient to explore why things aren't working for them. There might have been barriers or challenges that present themselves that they may not have thought of at the start of the exercise. So it's really useful to have a means of discussing these issues that arise rather than abandoning the exercise program. And that has been shown in many clinical trials that the combination of doing the graded exercise program alongside fairly significant medical supervision definitely increases the chances of success of the program. The last thing to say is that it is this condition called post-exertion malaise that tends to put people off exercise. So just a few words on that. Firstly, if you do very small amounts of exercise, you have a lower chance of getting post-exertion malaise in the first place. So that is definitely the advice at the start. The other thing to say is that when you start any exercise program, there is what is described as an indeterminate phase at the onset of the exercise program in the first few weeks. This is a phase where either you're not noticing any difference from the exercise at all, or it is making your symptoms a little bit worse. So it's in this phase that it is most important to try to keep up the motivation, and if you can get a face-to-face consultation, it's a good idea to get it in this phase, because if you get through this phase and you do manage to then gradually start increasing up the exercise, then you will probably begin to notice a difference in your symptoms.